During this presentation, I'm going to talk to you about some common signs of autism, the criteria and thresholds for diagnosing autism, common practices and interventions used in educating those that are on the spectrum, as well as the challenges in helping an adult with ASD transition into an independent working adult. First, I will discuss some of the common signs of autism as well as the criteria for diagnosing the disorder. Some common characteristics of children with autism include speaking in a robot-like voice or flat-toned voice. Children with autism also rarely make eye contact and lack certain social skills like sharing toys with playmates so that they too can enjoy the object. Those with ASD might not respond to their name when it's called, and they may also have delayed speech development. As they get older, it might be difficult for them to carry on a conversation in a normal manner, and they may not understand social cues or feelings. Another common characteristic seen in those with the disorder is repetitive speech, hand flapping, and lining up of objects. Those with ASD often prefer routine and have difficulty adapting to a change in the routine. Finally, they may respond unusually to loud or uncommon sounds, according to Turnbull et al. 2020.
Although some parents might be quick to express concern that their child is displaying signs of autism, there are some additional criteria that are used by the education system to evaluate a child to determine first if they are on the spectrum, and if so, to what level. This is done by the school or an outside specialist via a non-discriminatory evaluation process. One of the standard tests is the Autism Diagnostic Interviews. This consists of 3 domains: language communication, reciprocal social interactions, and restricted, repetitive, and stereotyped behaviors and interests. The test consists of 93 questions and takes approximately 1.5 to 2.5 hours. If the evaluation yields results indicating that the student is on the spectrum, a functional behavioral assessment is conducted. This identifies relationships between students' behavior and the circumstances that trigger those behaviors. A behavior intervention plan is also prepared in the event that a student's behavior impedes learning or requires discipline. It may be overwhelming for a parent or new teacher to determine best practices and interventions that can be used to teach children with ASD. The next couple of slides will walk you through some proven best practices used in education as well as additional interventions that can be used inside or outside of the school setting. According to Turnbull et al. 2020, several research-based practices have been effective in helping those on the spectrum. The pyramid model of positive behavior supports focuses on social and emotional skill development and has a strong family engagement component. The first piece of this is social stories. These are short scenarios which describe social situations, social cues, and appropriate responses to those cues. The second is self-instruction. This is used to teach the child to use cues on what to do next when performing a task or activity. Next is self-scheduling. This involves teaching a student to self-regulate their schedule and adjust as needed throughout the day. Self-modeling is simply observing videos or pictures of oneself doing an activity to improve themselves or learn something new. Lastly, self-monitoring, which is one of the most effective strategies, teaches the student to collect data on their progress towards an educational goal. Examples include completing checklists or charting their progress on graph paper. According to the Raising Children Network 2020, there are 3 types of intervention. The first is behavioral intervention. This teaches children new behaviors by using structured techniques. These approaches are probably the most studied and best supported by evidence and research. Positive behavior support is the most researched and commonly used behavior intervention. The second is therapy-based intervention. This incorporates speech therapy to help the child develop communication, social skills. Occupational therapy is used to develop skills for daily life, including physical skills. Therapy-based approaches are often used together. Lastly, medical intervention includes the use of medication for behaviors such as inattention, hyperactivity, anxiety, obsessive-compulsive behavior, self-harming behavior, and sleep disorders. According to the Workforce Innovation and Opportunity Act, statute prioritizes and increases employment of people with disability in competitive integrated employment, CIE. CIE is in place to ensure employees with disabilities have a fair opportunity to receive at least minimum wage for the work that they do. CIE limits the use of 14C, which allows some people with disabilities to be paid below minimum wage for their work. Basically, all employees should be compensated fairly despite having a disability. Although the CIE is in place to ensure workers with disabilities are fairly compensated, there are still other issues impacting employment rates of those with disabilities, including autism. According to Rowe in 2019, an ongoing issue related to autism is the continued low employment rate of those with ASD and the lack of effort put forth by the states to establish goals or outcomes for these individuals. This means that the states are not putting forth much effort towards the need for vocational rehabilitation and employment of those with ASD. Additionally, the need for on the job training by a quality trained specialist has not been documented, nor is it uniform from state to state. States have also not done anything to ensure that families have continued support as a student transitions into adulthood and work life. Here are some interesting statistics on autism collected by the Centers for Disease Control and Prevention. As you can see, 80 to 90% of adults with autism are unemployed. This is more than likely because the lack of effort being put forth by the states and not because families don't want to see their relatives lead somewhat independent and successful lives.